On this episode of Cracking Coconuts, we're going to discuss the current situation of the coronavirus pandemic both here in the UK and in South Asia. We're also joined by an anaesthetic and critical care doctor to talk about his experience on the front line and why you should be staying at home. Okay, hello, it's Vinorshan again, joined by Nahim.
What's up?
Thought it would be a bit more of a. We'll talk about something else in this episode.
I
A bit
feel
more
like-
happier note.
I feel like we're destined to just talk about coronavirus
Always,
until the end of time.
yeah. You've been keeping yourself busy.
I've been self-isolating
Yeah,
like a good citizen.
good. Abiding by the rules. So have I. Trying to get the fitness in, home workouts.
It's
Tough, man. It's
it's
harder
very
than it
tough.
looks.
Yeah, I'm going a bit crazy, just stuck in the house.
Yeah, I've seen you do a few TikTok videos. That was cool.
You have not seen me do any TikTok videos.
You know who needs to be key workers, man?
Who?
Barbers.
Yeah, 100%.
I am needing a fresh trim.
I look like I live in a jungle.
Shave it off, all of it.
Nah, I think we can teach ourselves. There's YouTube videos.
I don't know if I trust you to cut my hair, man.
Why? I give a good fade. Nice fade.
No fade. Boss, please give me a nice fade, and then you just give me a dead one. It's all right. I'll be staying at home anyway, so what's there to lose? We're joined today by Paran, an anaesthetic and critical care doctor working on the front line in managing COVID-19 patients. He is our housemate, so we're not breaking any rules and social distancing or anything like that. How's it going, man?
It's all right, man.
So how's work been?
Work's been really eye-opening, actually. I don't think we've seen anything before like this. And I don't just mean because I'm near the start of my training. Even consultants who've been around for 20, 30 years, it's quite a new experience for them. So we're all in this together and having a new experience. Nothing has hit the world like this quite hard. It's been quite sad because I don't know how other doctors out there feel, but personally I've been a bit desensitized. Eventually you see lots of people dying, sadly, and you kind of lose an emotional connection. I've never really cried over clinical work or anything like that. You maintain a distance from it. But this current situation has got to a lot of us, really. We're seeing quite young people pass away. It's particularly distressing for the families because if they've been with them, they've been in isolation as well. So they're not even able to say goodbye to them in the last few moments, it's a really cruel goodbye. But yeah, it's probably one of the saddest things, not just me, but a lot of people have seen. But we just need to keep grinding, I think.
Cool. So what's your day to day? When you go into the hospital? What are you taking? What are you doing? What are you taking care of?
So I'm an anaesthetist. So we look after operating theatres where we put patients to sleep for operations and we wake them up. But we also look after the intensive care unit. And intensive care unit, so what we see there is a very skewed picture. So from the data we have at the moment, we know 80% of people, or so we're told 80% of people, recover well at home. 18% will need to come to hospital. And then 2% will have to come onto the intensive care unit. So just to explain to people a little bit what that's about and how it's different to any other ward. People come to the intensive care unit for something we call organ support. So if your heart doesn't work, if your lungs don't really work, or if your kidneys don't really work. So if they're not able to manage that on the ward, then they'll bring them up to the intensive care unit.
So getting wired up.
Wired up, essentially, yeah.
So why is it that coronavirus patients in particular need to go to the intensive care
We're
unit?
getting there. So before we talk about that, we'd say that not everyone will be able to go on to the intensive care unit. Because a problem is with the intensive care unit, when you put people there and you put them on like a lot of drugs, a lot of support for their organs, they have to be able to come off it as well and go back to the wards and then go home eventually. And not everyone's body is able to do that, which is why you'll only be accepted onto the intensive care unit if you have quite a fit and healthy lifestyle beforehand. That doesn't mean you have to be young. There are older people who get taken there as well. But your body needs to have the reserve to be able for your organs to regain their function back. So normally we breathe oxygen, it goes into our lungs, makes its way into our blood. What's happening with these coronavirus patients is they're getting an immune response in their lungs, which means when they're not getting enough oxygen into their lungs, and it's not going from their lungs into their blood. To compensate for this, what me and you would do is we'd breathe harder and we'd breathe faster, right? To bring to make us breathe more and to bring the oxygen levels up. Sometimes it doesn't compensate enough, and the oxygen levels in our blood drop, and that's when we need support, because we need oxygen to keep us alive, right? So when someone comes into hospital, you can give them oxygen via the nasal prongs up the nose, or you can put a face mask on. But sometimes that's not enough, and the oxygen level drops anyway. And that's when they need something called ventilatory support, which is when we bring them onto the unit. So we need to help their breathing. So essentially, we put them on a ventilator, which is what everyone's talking about in the news.
Yeah, there's apparently a shortage of ventilators, not enough ventilators.
Not enough ventilators. So a ventilator is a machine that kind of basically inflates your lung for you. So you get adequate oxygen in, right? So you're not breathing well enough yourself, so the ventilator will help you breathe.
And you're knocked out for this. You're not.
In these coronavirus patients, they're knocked out with it. And eventually, as the immune response settles and you fight the virus, your breathing will improve itself, and you'll be able to wean off the ventilator and then go back to the ward and eventually home.
Is it basically then, from what you're saying, you're putting these patients on ventilators as a way to help their lungs breathe or get more oxygen into their bodies, while their immune system fights the virus?
Exactly.
You're not doing anything specifically for them to target the virus.
Well, what we know is there's no treatment that fights the virus at the moment, apart from supportive treatment. So,
what does that mean?
So supportive treatment is good hydration, good oxygenation, and maintaining the function of their other organs. Yeah. And then we know your immune system will fight the virus.
So it's just a matter of time.
It's just a matter of time.
And is that in any way related to, it's been going around in the media a lot, flattening the curve?
Exactly.
Okay.
So the average time these people are on these ventilators is it's ranging for, I think, about 5 to 7 days. They're needing to be on this ventilator, which is why this flattening the curve thing is so important. So each hospital has a certain number of intensive care beds, and there's a reason for that, because the equipment on it, the ventilators, are very expensive, and all the equipment, in fact. So an intensive care unit is really expensive to run. And you need specialist training for it. For the nurses and for the doctors, they all need to be specially trained. So it can range in a hospital from, a small hospital can have 10 beds, a big hospital in London might have 100 beds. But wherever you are, it's a limited number of beds. You can't then put these ventilators on a normal ward. Yeah? So eventually, we will run out of them. Which is why this flattening the curve thing is so important. Because simplistically put, if you have 2 patients at the same time who need a ventilator, but you only have 1, someone will miss out, and they're at quite a high chance of not getting enough oxygen and eventually dying. So by flattening this curve, what you do is you delay the transmission. So one person goes on the ventilator, they're allowed time to get well and come off it before the next person goes onto it. And that's what we're doing with the social distancing. We're delaying the transmission to give everyone the opportunity to get onto the ventilator, which is why we want to stay at home. So yeah, that's what we do.
Thanks for that. I hope all the listeners are taking notes. We're going to do a quick quiz for this lecture afterwards.
And I hope you haven't fallen asleep.
So, protective gear that you have. There's been a limited stock of face masks.
Yeah,
The whole suit and everything. So you're geared up when you're treating patients.
for sure.
And do you feel like there's been a struggle for those things?
There's been really big topic, again in the news, and within the hospital, everyone can't stop talking about this. So there's a name for it. We say PPE, personal protective equipment. It can be really confusing, and it's depending upon the patient you see and the procedure that you're doing. But essentially, you're just trying to cover parts of your body where it's easy for infections to enter. So it usually consists of gloves, a gown, a mask, and like a visor for your eyes. So there's currently like 3 levels of it. If there's a COVID unknown patient, so you don't know what their COVID status is. So it's all kind of the same: gloves, gown, mask, visor, but different levels of it. And then you have a COVID positive patient. You're doing a bit more for that. And then when the procedure related ones, because there are certain things which are more risky. So when you're putting someone on a ventilator, we say it's an aerosol generating procedure. So essentially, it's like an aerosol. A ventilator is forcing oxygen in. So what it does actually, it sprays the virus around. So it gives you like a really high viral load. So to prevent that, when we handle the ventilators, we're in like the ultimate kind of PPE level of being covered up. So yeah, and there's been talk of a shortage of it. It is always going around the hospital, and no one can stop talking about it. But to be honest, in my personal experience, I've never been in a position where I've not been given it.
Sure. I'm guessing it's not very comfortable to be in.
It is awful to be in. It is so uncomfortable.
Hot.
It's so hot.
Yeah, and how long do you have to wear it for?
Sometimes the whole case. Sometimes, like, I was in one for 6 hours the other day.
6 hours.
It is horrible. Yeah. You've got this really tight-fitting mask on, and then you start to realise how much your breath actually stinks, because you're just kind of...
No way.
There's not really much leakage. So yeah, really uncomfortable, but yeah, we take the ultimate precautions.
Mm-hmm. And then there's also this whole topic about testing, lack of testing. Prince Charles only got mild symptoms and he got tested straight away.
When did Boris get tested?
He got tested the day he had symptoms, didn't
Did he?
Or the day after.
You can give Boris a little bit of a pass, no?
Why?
He's leading the country.
What about Charles?
Yeah.
Charles.
I completely get that. My issue would be the NHS staff, frontline NHS staff, and when they're going to be tested. I don't know what your thoughts are on that, but it's a difficult one because there's obviously different types of tests, and Param maybe can tell us a bit more about that. There's tests that check if you're infected at the moment, or there's tests that show if you've been infected and you're now immune. And I guess it depends on the availability of those tests, what test you have. But as an NHS worker, it just seems a bit unfair, I guess, to be always in such a high risk environment and then be told, no, you're not eligible to be tested.
So have you been tested? Have your colleagues been tested?
I have not been tested, but the testing was meant to roll out from today, and I was working yesterday. So so maybe I'm just not there at the right times. There's talk of it coming this week.
Okay.
If not the week after. So it's coming. We are getting the testing.
Sure.
In a way, I kind of understand why they're not testing.
Okay.
I think you spoke to me about this, Nahim.
Yeah, I had a kind of light bulb moment, and I realised, okay, maybe it makes sense not to test, because at the time, the only test that was being used was the antigen test, which is to test for whether there's actual virus in your body.
So doing a PCR test.
Yeah. They're testing for the viral antigen, right?
So they were testing for the viral for the viral PCR.
Lots of science terms here. Antigen, PCR.
It's just a complex test, but it tells you whether you have the virus in your
Yeah.
body.
So rather than testing if you're immune to it or anything, it checks if you've got the virus in your blood.
Mm-hmm.
Yeah. And it took them 48 hours for the test results to come back. But in reality, we have a lot of patients on the unit who are they're suspected COVID, but it's been 6 days and the test results aren't back yet. So we've got a lot of patients who are potentially positive, but their test results aren't back. So it's taking them longer than those 48 hours. Which is why I think the lack of testing for NHS staff kind of makes sense. And I'm going to take Nahim's point here.
Make it your own point, man.
I'm going to make it my
Why are
own
you giving
point.
him the ratings?
In a way, like, I get it, because if the testing has a minimum of 48-hour turnaround, and you've got a doctor who sees, in A&E, who sees about, I don't know how many patients a day, say 20 a day, if he sees a suspected COVID patient, do you then test him and let him carry on working? Or do you test him or take him out for 48 hours? Because if you're suspecting COVID and then you let him carry on working, you potentially infect all the patients you see later on that day and the rest of the staff. So I think if you're seeing a suspected COVID and you're testing, you then have to take him out of the workforce for 48 hours.
If you're doing that, it's not just him, it's all the other doctors as well. Or do you stagger the tests for people? Or you could get tested,
Yeah.
and the test comes back 48 hours later and it says it's negative.
And then,
But in that 48 hours, you might have seen the next patient after you got
Exactly.
tested who might have been positive or that you didn't know about.
exactly, which is why I think if you're testing for someone with that test, you need to take them out of the workforce.
But you can't feasibly do that.
You can't feasibly do that. How do you take that many doctors out of the workforce at one time? And you're only negative until your next patient, until your next potential COVID patient. So say you're an A&E doctor and you're working on Monday and you see the first patient you see, they've come with a cough and a fever. You test them, you take him out of the workforce for 48 hours, he comes back on Wednesday, the first person he sees is suspected COVID, and you test him again. He's negative, he comes back on Friday, and the whole week he's only seen 2 patients.
It's continuous testing.
The NHS won't survive. No healthcare has enough staff to be testing that regularly, which is why they're rolling it out now when they have a test which has a quicker turnaround, where you can test people and almost instantly get a result, so you can send them back into work.
Okay.
This is much more useful because there are people isolating for 7 days, healthcare workers isolating for 14 days, like valuable healthcare staff, right? Now you can test them and get back to work straight away. So I think it kind of made sense not to test when it was a 48-hour turnaround.
Okay.
Because it's not feasible. There's a common misconception. I think Nahim touched on it earlier. This only hits old people. This is really not true. We've seen a lot of young people on the unit getting really unwell and passing away. So this is not something which is selectively hitting the old people. And yeah, they're more prone to it. But it's producing a kind of illness which is really, really bad. And even people who are fit and well. We get middle-aged people playing golf on no medication. And they're really struggling on the unit. And quite a few have passed away already. A lot of the consultants, a lot of the bosses are getting a bit frightened at this point. People just like them, their age, healthy people, really not coping well with this illness. So yeah, there is a common misconception that this hits the old only, and it's not. It hits everyone, young people. There's a 21-year-old that was reported in the news. It's sadder when it hits a young person, but... And the other thing is we are filling up, and it is going to get worse before it gets better. Every hospital will be expanding their intensive care units. We've doubled the size of our unit, but we expect to be full within the next 3 days, actually. And then it becomes a matter of, do you take people off it who you don't think need it, or do you have to transfer people out to other hospitals? We're going to reach capacity within the next week. We're going to get to a position where there is no ventilator to put a patient who needs it on. So these hospitals are very necessary. We're seeing it firsthand. They're required. So if we have to transfer it out, it might be to one of these hospitals. So what this ensures is that everyone will have access to a ventilator, right? they might not do well off it. I think the stats we're seeing are like 60 to 70% of people even on a ventilator are dying. But it means everyone will get access to one at least.
That's the minimum you can provide.
That's the minimum you can provide.
At least give them a fighting chance.
Yeah, so yeah, it's these are common misconceptions. It is hitting the young. It's going to get really bad before it gets better. And it's happening right now. Do you know what I don't get? I went to Morrison's today after work, and the amount of FFP3 masks walking around Morrison's.
People wearing them.
Where did they get them from? Off the internet? From a family member at work?
People stealing from the hospitals.
People stealing from the hospital, man.
People are stealing from... Talking about stealing.
What have you stolen?
I haven't stolen anything. Yeah, people stealing. People are stealing other people, NHS workers, NHS cards to get that 50% off Pret.
Who goes into Pret anyway?
Now, who goes into Pret anyways? But yeah, there's been obviously probably just some isolated cases, but people are stealing from NHS workers, not really being that grateful. But on the other side of things...
We've done some good stuff too.
We've done some really, really good stuff. So there was the clap. People came out to this, just outside their house or out the window to clap for the NHS.
I think we missed that, didn't we?
We did miss it. I was hoping you wouldn't say that, but we did miss it.
It's embarrassing, but...
It's embarrassing. It's okay.
We all work for the NHS here.
We were aware of it. We're not going to clap for ourselves.
But that was nice.
Real nice.
Real nice that we did that.
And I think, everyone's in agreement. This is a very small minority of people who are stealing ID badges.
Yeah.
I think there was one reported case in South London where they probably would have taken the money if they didn't take the ID card. So what would you prefer to lose?
But yeah, some really good things for people supporting the NHS. What did you get?
There's there's a lot of obviously horrible reports out there, but there's real altruism out there as well. The clap in itself was it was really heartwarming. I know, even if it doesn't help us that much day to day, it really helps to know that we're all in this together. From a picking us up point of view, that was really nice.
What about those goodies that you got?
Oh yeah. So I was driving back from a night shift on the intensive care unit.
Of course,
and
as you do.
I drove past our local pub,
which is closed.
Which is closed, of course. But we support our small businesses, so they know us. So that the pub owner lives next door to the pub, and he has a little vegetable allotment. So I was coming home on Saturday morning, and he had a table outside and sacks of vegetables and eggs, free for NHS staff.
It's nice of him.
Isn't that incredible?
It's really nice.
Straight from his allotment.
Yeah.
They tasted better than any supermarket potato.
Ah.
Organic. Maybe they're not organic.
Maybe he got them from Waitrose.
Yeah, but at least he gave it to you.
Yeah.
That's really nice of him. Yeah, it's good. Thanks for that, Parent.
No, I think it's obviously a really tough time for everyone, and we need to get each other through it.
Yeah.
So I think little things like that really, really help. This will be a tough period, the next few months.
Moving on, things have drastically changed in South Asia, where they've been taking quite an aggressive approach, and countries have either gone into a complete or partial lockdown. The population in the region have always been at a greater risk, and measures that we would put in place here in the UK are quite a challenge. Social distancing for a start.
Yeah, understandably so. There's over 1 billion people in India. It's 1.5 billion now. It's obviously going to be difficult in such a densely packed country to practice effective social distancing. I think we have a bit of a luxury here where it's a lot easier for us to abide by government measures, whether that's as a result of having a bit more space or having the financial means to do so. So like I said, there's total lockdown in India, announced by their Prime Minister. They are free to go out for food and medicine and things like that. But there's been loads of videos showing how it's being enforced. And I think not just in India, in a lot of other South Asian countries as well.
Yeah.
How
the police are just brutal.
Brutal, yeah.
Brutal.
I've seen videos of guys on scooters or mopeds out maybe when they shouldn't be, and then you see the police come along with a baton, as in
you could see it both ways. You could kind of think that, sure, you know, it's bad, you shouldn't hit anyone, people are just getting smacked up for no reason. But then the other side is like, yo, why are you not listening? Why are you not taking this serious?
Yeah.
Why are you out?
I think it's easy to say from our position, really, isn't it? Why don't you understand that this is such a serious public health issue? But if you look at some people in terms of, like from their viewpoint, and what I wanted to talk about is like the migrant workers in India, whether or not they have an idea of how big of a public health crisis this coronavirus could be. A lot of the population in somewhere like Delhi or Mumbai are migrant workers. So they've come from rural villages, come into the city to find work. And it's work in terms of being a labourer, working in factories, jobs that mean they're living paycheck to paycheck, sending a lot of money back to their families in the village so they can survive. As a result of this lockdown, factories have been shut. Then they've
lost their job, essentially.
They don't have an income anymore. So if they don't have an income, they're not going to be able to support themselves. They're not going to be able to get food and survive. So you or me, the logical thing would be, okay, there's no reason me staying in this city because I'm going to starve to death. So I'm just going to go back home, go back to my village. But as a result of the lockdown, public transport's been cancelled. So it's difficult for them to do so. And you see reports of a lot of these migrant workers migrating back to their villages, sometimes on foot. And that obviously is very bad for social distancing and initiatives like that. But what would you do in their situation? Are you meant to starve to death?
Yeah. So it's mass
crowds. I understand it. It's a difficult situation to be in. The Indian government, after this was happening, they announced a big multi-billion-dollar package to provide food and aid for these people. But in terms of the news reports, it's still happening. It's not really had that much of an effect.
So Pakistan leads South Asia with a number of cases, with 1,865 cases and 25 deaths. Punjab is currently the region with the highest number of cases at 600. This is actually most likely to be higher than that recorded because of the lack of testing capacity in the country. There's been a case of a Dr. Osama Riaz. He was 26 and was working in the northern Gilgit-Baltistan border, screening pilgrims returning from Iran, where there was a lot of cases earlier on, and he sadly contracted the disease and passed away. Medical professionals have been criticised in the country for the lack of protective gear provided to the frontline staff.
And again, there's been a case even with Friday prayers. Despite there being a ban, which was quite loosely put on mosques and things, people still flocked. People still came to mosques and demanded them to be open. You know, some of the people were just saying, you know, I've never missed Friday prayers in my life. No virus is going to stop me from doing that. And that's obviously bringing a lot of people together, really going against the whole social distancing thing.
So you said they haven't really enforced it. So it's just been like a general message.
Yeah, and advice in a sense. Yeah,
Right. But not like a lockdown like we've seen in other places.
No, yeah.
And do you think that might be why?
Yeah, it is obviously part of the reason. I think they're going to bring it in full effect next Friday, but a little too late. Are people still going to be listening to that? It's already up in the air with it.
And how many infections are you going to get in that time frame?
Exactly. A week, you know, everything could be different. And the second is India with 1,161 cases and 28 deaths. So you were saying about the migrant workers.
Yeah. So like I said, in contrast to Pakistan, they are in lockdown. And yeah, it's, again, like we were speaking off air a little bit about whether public health messages are going through. So there was a kind of similar case in India as well. A 70-year-old gentleman in Punjab recently returned from Italy and Germany and ignored self-quarantine advice.
Okay.
Later attended a Sikh religious festival which attracted about 60,000 people over the course of 6 days. So obviously exposed to a lot of people. He was later found to be positive for coronavirus, later died. 19 of his relatives tested positive, and as a result of that, 40,000 people in 20 surrounding villages have been quarantined. So yeah, it just goes to show how much of an effect a single person's actions can have, for better or for worse. And that's why it's really important to get on board with these public health messages, whether you're living in South Asia or whether you're in the Western world, because it can affect thousands and thousands of people. There's one more story from India. I just want to get Paran's opinion on it because it hits a bit closer to home. So there's been loads of reports coming out of India about doctors, nurses, and other frontline workers that have come under attack over fears of infection. So there have been reports that healthcare workers are being harassed by their neighbours and being threatened with eviction by their landlords. This is a quote from the Resident Doctors Association of New Delhi. Many doctors are now stranded on the roads with all their luggage, nowhere to go across the country, just because they come home from a shift, working in a hospital after work, and whether just due to fear or whatever, their landlords and neighbours are refusing to let them into their own house. So coming from an environment where they're treating ill patients with coronavirus, potentially, they're coming home, and because of fears of transmission, people around them are not letting them in back to their own house.
It's ironic, isn't it? Like, in a country or the subcontinent where people kind of worship doctors, now they're getting kicked out. Again, you see it from both sides. You're concerned about your own safety, your family's safety, but at the same time, these people they're helping the people that are really in need. I think there's reports of it in this country as well.
Is there?
Yeah, so I don't think it's limited to that side of the world. But yeah, it's
as in, obviously I don't condone it. Yeah. I'm not sure if you do, but it is a human reaction, that kind of fear around something you can't see, something you can't control.
Yes.
Well, you can control it, but to an extent, it's an invisible thing that might result in you being really ill, or a loved one being really ill. So you kind of become irrational in your responses.
Sure. And the other thing is, these doctors probably come home with loads of contagious diseases, especially in the subcontinent. There's so much going around. Yeah. They've never been kicked out for that. I guess when something gains so much attention, and they've seen it in the Western world maybe, that they're distancing over there, then they feel the need to do it over there again.
So what's it like in Sri Lanka?
So Sri Lanka is third on the list with 122 cases and 2 deaths. A much more militarized approach.
How so?
The military was the first responders to the pandemic. They really set them out to do most of the work in terms of putting up the quarantine centres, manning checkpoints in terms of lockdown and curfew. But yeah, lots of really racial undertones too. There's obviously been some divisions and ethnic conflicts in the country before. The majority Sinhalese population, which controls the government, and there's obviously the minority Tamil and Muslim populations in the country too. What's interesting is one of the first quarantine centres that was set up was in the south, next to Colombo, a place called Handala. Set up in a leprosy hospital there, and it was faced by a lot of protest, people not wanting it here, even though it was quoted to be ideal and close to where the first people were diagnosed and infected with the disease, right? So it's right next to Colombo, the only real international airport on the island. Then after all the kind of protests, they moved it. It was continuous protest. They moved it over 300 kilometers away to a place called Batkala, which is a completely different demographic. It's a lot more Tamils and Muslim people in the area.
So as a result of the protests, they moved the quarantine center as a result of the protests.
Yeah.
Okay.
So they took the patients
Yeah. So what
over to over 300 kilometers away from where it first was. Obviously faced with even more protests over there, while you're bringing it over here.
Yeah.
A lot of panic, a lot of fear as well, because it's all it's more military based too, in places where there's already a lot of heavy military presence, and it's really adding on to that. And a lot of the quarantine centers have been set up in the north and east, which is predominantly Tamil and Muslim.
As like you said, there's some racial undertones.
Exactly. Was a real reasoning behind that. To move it, it wouldn't make sense in another country, right? To have patients who have been diagnosed with COVID, and then to ship them off to somewhere else,
Yeah.
right? You would want to try and contain it and deal with it at the point of, right? And to really add to it,
Leading the military response is Shavendra Silva, alleged war criminal for war crimes committed at the final stages of the conflict in Sri Lanka in 2009, where up to 70,000 Tamils were killed.
Exactly the type of person you want in charge.
exactly. But yeah, so he's been put in charge of also controlling this pandemic. Again, it's really just instead of trying to more steps in the right direction, it's just causing more, really fear mongering in terms of the people, the Tamils in the north and east.
It must be horrible for these patients. They feel like they're blacklisted, innit?
Yeah,
They move from one part of the island to the other. We don't want you here.
exactly. Yeah.
Yeah.
There was also even some Buddhist monks that had done like a pilgrimage or something in India, flown into Colombo, but then taken to the north, an area called Jaffna, to be quarantined. So that's many, many miles, and be sent off all the way. It really lacks logic in terms of why they would do that.
Is it like a more rural area? Is that why, or is it just as dense in terms of a population?
It is dense. There's a lot of people there.
It's not like a reason that we want to take it away from a heavily populated area to a less populated area, so less people get infected. It seems more like let's take it from a major city with predominantly Sinhalese majority to a Tamil majority area. That seems like
kind of what you're kind of implying from what's going on. Yeah.
Because there are other, smaller regions within the country, much smaller than Jaffna,
Yeah.
where there aren't Tamils, where there are Sinhalese.
Why not there?
Why not there?
It begs the question. You can't really tell why else it would be. So Bangladesh has 48 cases and 5 reported deaths as of right now.
doing relatively well. It seems like it.
Yeah.
And a bit of good news that's come out of Bangladesh. They've developed a very cheap testing kit for coronavirus. So they claim it costs $3.
Cheap.
Yeah. And you get the results within 15 minutes.
Quick.
Yeah. And the creator says it works in 90% of cases. So
it's not 100%.
no.
What is
Accurate.
100% though?
Exactly. And just comparing it, really. So I think Paran spoke about the gold standard test at the moment, so the PCR test. In Bangladesh, anyway, that costs anywhere ranging from about $120 to $130. You need a machine specific to run that test, and that can cost up to $90,000. Whereas this test costs $3, gives you a result in 15 minutes. If it works in 90% of the cases, why would you not use it?
Sounds like a no-brainer, but...
Well, there are some issues. So the kit looks for antibodies, which means once you get infected and your body tries to fight off the infection, it produces these things called antibodies. And the test looks for that as a way to signal that you've been infected, if that makes sense.
Okay.
That does, yeah.
Yeah. So
Well, it
Because-
should make sense to you, Paran, because you're a doctor.
because of the way it works, there's a margin of error, so it could return a false negative if it's used too early. So you need to wait for your body to develop these antibodies as a result of the virus. And it's not just a one-off. The same guy, the same doctor, developed a similar kit that was used for SARS during the epidemic in 2005.
This guy's a saviour.
The Chinese government bought that patent, and according to them, it proved quite effective. So it's
Which book did he read that no one else read?
how to make coronavirus testing kits.
Ah, it's a good book. So yeah, rapid tests. So when are they planning to roll this out? And when can other countries get their hands on it?
So they've set it up to be mass-produced, and it's been given the green light for production. So I guess it depends on other countries ordering it if they feel like they need it. But the gentleman that made it, it was essentially made due to the unique needs of the Bangladeshi population. It's a less developed country, so there's less money to be spent on healthcare. So cheaper, more affordable avenues in terms of testing for viruses like this are key in terms of dealing with a pandemic like this.
So there's been 5 reported deaths, but after the first death,
something really stupid happened. Following the first death, tens of thousands of Muslims gathered for a mass prayer session. I said it was stupid. There's no other reason for it. It was organised by a influential religious leader from a village. He urged people to join him in praying for protection against the coronavirus, all the while risking even further spread of the virus by having thousands of people congregating next to each other in one location. Similar thing happened in Malaysia in February, following which that event was confirmed as the source of over 500 infections. So we still need to wait a bit and see what the result of this is. But chances are there will have been infections as a result of this just by getting that many people together in one place. Just talking about crowds, so in Bangladesh, there's I think this is the world's largest refugee camp, but I'm not 100% sure. So the Rohingya refugee camp in Cox's Bazar. So Rohingya, the refugees from Myanmar that are living in the refugee camp in Bangladesh, very vulnerable, very crowded, probably most at risk in the country of contracting and rapidly spreading the virus. So reports are saying there's wretched conditions in the camp. Social distancing is virtually impossible, according to the head of Doctors Without Borders in Bangladesh. No masks, no hand sanitizers to speak of. On top of that, there's an internet lockdown. So no access to internet, so a lack of an ability or a means to
gain that knowledge, know what to do.
Get the most up-to-date information about what's happening and what to do, whether the advice is changing. And I could just say, in the healthcare setting, the advice is constantly changing. The guidelines are constantly changing about how to deal with cases like this, because it's such a new thing. We're learning on the go. So to restrict a group of people from accessing that information is cruel, essentially, especially when it's such a vulnerable breeding ground for spreading the virus.
Yeah, similar to Kashmir as well. Internet shut down up until now January, where the Indian government has opened things up a little bit, but it's really limited themselves to particular websites, and also just on mobile phones, just 2G connections, right?
Does 2G still work?
Imagine if it comes up with 3G, we're already sweating. So imagine 2G.
Can you load videos on 2G?
So a lot of people are frustrated, and obviously, again, can't get the up to date advice, knowledge, and what really to do.
And with that, we bring this episode to a close. Thanks, Paran, for coming on.
So what would you say the take-home message is, quite literally?
Take-home message will be stay at home. I think stay at home is a good idea.
Yeah.
Let's flatten that curve. Let's keep enough ventilators for everyone. This experience will change everyone, I think. I think everyone's life will slow down, give everyone a bit of perspective, and a real appreciation for the small things in life. So it's tough now. I think we'll all come out better from it.
Thanks again for listening. Hope you enjoyed the episode. Make sure to rate and subscribe on Apple Podcasts or wherever you get your podcasts. And make sure to follow 47 Roots on Instagram. And that's us signing out.